Thank you very much, Maurizio. Good afternoon, everybody. It's a pleasure to be here, and let me take you through the exciting business of Nestlé Health Science. First of all, let me start by just saying what employees at Nestlé Health Science are passionate about, and this is about empowering healthier lives through nutrition. And very often, this is impacted by personal and family experiences. I will take you through our business, and then we'll deep dive in our strategy, creating shared value, and last but not least, a few numbers on our business. So first, just a few numbers. Nestlé Health Science is a 2.7 billion business. Our underlying top number is 15.5. We're investing for growth and driving scale. And then last but not least, we're focusing on two categories, consumer care and medical nutrition, that are more or less evenly split. Let me just take you through a little bit of deep dive on the two categories. First, consumer care is a large and attractive category. We define this category as nutritional supplement, vitamin, minerals, and supplements. It excludes drugs, OTC. It is a fragmented category. There are few global players, and we're a strong number 3 in that category. The growth is driven by underlying trends, and I'll take you through those trends afterwards. Private label is very low at below 10% rate, and we're driving about a 2x category growth in this segment. Medical nutrition, on the other hand, is a smaller category, but with very attractive growth. The definition of medical nutrition is medical food for special health conditions, from acute care to pediatrics. It has significant overlap with the consumer care business. It is fairly consolidated with 2 global players. The other players are really regional or local, and we're a strong number 2. The channel here is evenly split between what we call institutional, hospital, nursing home, home care, and about 50% in pharmacy. The key trends in in both categories can be summarized as here you can see here. First of all about health consciousness, prevention, and self-pay, driven by this Dr. Google. 1 in 20 Google searches today are related to health information. Over half of US health purchases are driven by digital. And so we see significant opportunity in specialized diets also. When you look at, for example, searches on Google related to ketogenic diets, this is at all-time high. The growth in these categories are also driven by natural, organic, non-GMO, real food, and sustainability. And then a significant growth in both categories is specific conditions, these specialty conditions, that drives about a 5x growth versus the general nutrition. And last but not least, a key influence on the growth in these categories is the significant increase of evidence, scientific evidence, supporting nutrition and health. And if you look at the number of high-quality publications and studies that relate nutrition and health in the last 2 decades, that number has been multiplied by 20x. So one more last slide on our business. Let me just highlight some of our key brands, leading brands on the consumer care side. First, with Garden of Life, it is a leading VMS brand in the specialty retail and also leading in e-commerce. It is a 100% portfolio, organic, non-GMO certified. We also have Pure Encapsulation as a leading brand in VMS for professionals, healthcare practitioners. And here, this brand is about innovative leadership in high quality, free from movement, nothing but pure. Then we have leading brands with Boost and Nutrient Senior, for example. These are nutritional brands, nutritional supplements, allowing the 60+ to achieve and maintain healthy nutrition and achieve complete nutrition. And then in medical nutrition, we're a global leader in specialty in, for example, specific range, complete nutrition for the most vulnerable, all the way to intensive care units. With Alpha Amino, we have a leading brand for children suffering from severe food allergy. Here we provide nutritionally complete solution, allowing children to grow to their full potential. And then last but not least, leading brands in tube feeding and oral nutrition, in surgery, cancer, and, for example, gastrointestinal malabsorption. So let's talk a little bit about strategy, and we'll start very high level, and then I'll deep dive. So with this unique portfolio I just described, we have really an amazing opportunity to go from prevention to treat all the way to treatment with a specialty nutrition, science-based, and high-quality portfolio. We basically offer the best coverage in nutrition and health. Now, this broad portfolio, combined with a unique capability to execute, gives us a repeatable, successful model. We have about 5,000 professional employees in our business. About 40% of them focus on healthcare providers. We reach more than 300,000 healthcare providers across the world, and we provide them high-quality content and education. We focus on reimbursement and market access for patients. But at the same time, we have significant capability on consumers, from consumer insights, DTC, retail, but also we manage more than 1,000 ambassadors, giving us access and coverage for 100 million plus followers. So a bit more substance on what we're focusing on to drive our growth at 2X category. First of all, growing our core, medical nutrition, consumer care, with significant growth opportunities in market where we're already present. For example, we're investing significantly in China, where we're growing more than 40%. We're focusing on delivering new growth. I will deep dive on some example where we're focusing in leading innovation and as well as internal and external opportunities. Let me just highlight here also how we're focusing on sustainable operational excellence, driving synergies between all the categories we play in terms of reliable and efficient supply chain and manufacturing capability, R&D and clinical evidence building, excellence in quality, regulatory, and medical. This is key to the success of our business. Now, let me just deep dive in 6 areas where we are focusing to take advantage of the trends I highlighted before and deliver this accelerated growth. First of all, allergy, from prevention all the way to treatment. The prevalence of allergy is significant and high across the world, 10% in children, 6% in adults, and this offers significant opportunities. Healthy aging, Stefan this morning talked about the R&D capability that we have at Nestlé on the mitochondria, and this is a key area of focus. Obviously, you've heard a lot about how the extension of lifespan has happened. I think there is still a significant opportunity on extending health span, quality of life. This comes from providing better products in malnutrition, but also driving innovation in nutrition at the cellular level, nutrition cell by cell. Stefan also alluded to capability in R&D in microbiome, and this is another significant opportunity we're focusing on. Here, I would say the microbiome is responsible for 80% of your immune system. I call this the launchpad of your health, and we see significant opportunity. Nutritional also plays a significant role in weight management, diabetes. We focus on specific formulation impacting blood glucose level, for example. And I will take you in a few minutes through some examples of how we are capturing and focusing on personalization as well as e-commerce and digital technology. So starting with e-commerce, it is already a significant platform for Nestlé Health Science, 300 million in sales, with significant growth, focusing on the two largest opportunities for us, US and China, growing significantly with leading brands, Garden of Life and Pure Encapsulation, but also expanding further that growth through the rest of the world, e-commerce execution, and investing in digital health, providing services, problem service solution, which I'll provide you a few examples moving forward. Driving growth and differentiation through our pipeline, using exactly the same framework that Patrice Bulla highlighted this morning in his overview. We focus on consumer and patient trends we talked about this morning, as well as unmet needs and the benefits we can deliver to them. We're launching more than 150 products every year. Let me just highlight a few. On the natural organic, here Complete was the first tube feed, complete nutrition, real food, organic, non-GMO launch last year in the US. Significant success, driving significant growth for our business. On the authentic side, for example, we've entered with a full 20 SKUs herbal line launch in the supplements category, organic, non-GMO. This is a significant category, and we're already number 5, 6 months after launch. We also active in the vegan category. Stefan talked about the alternative protein technology in our R&D framework. And again, here we are the leading plant-based protein solution in specialty retail. With Garden of Life. We are the leading brand also in specialty retail with our probiotics and microbiome solution. And then last but not least, just highlighting experiences that we provide, providing services and product solution. Let me just highlight here the COPES program we just launched earlier this year. This is a service to help cancer patients meet their unique nutritional needs while being mindful of any side effect and nutritional challenges they may be experiencing during the treatment. Moving fast on trends, that's also core to our business. And let me just highlight very proudly that we are launching 19 SKUs in the CBD. We launched those 19 SKUs 2 weeks ago with Garden of Life. Soft gels, oils, and sprays. This is the first true national brand launch in health food store. We're setting the right standard with Garden of Life, a well-known, trusted brand. It is THC-free, third-party certified on purity and potency, organic, traceable, solvent-free extraction. So this is a major launch for us, very exciting, and you will get a sample in your goodie bags as you leave this meeting. You won't get high on that CBD. Now let me also highlight that at the same time while we launch in mass retail, we also launch a brand in the CBD professional range with the same quality standards that I explained before for Garden of Life, but adding patented delivery system for improved absorption. So that was launched also last week. Now let me also highlight how we innovate on personalization. There is a significant opportunity, as I mentioned before, and we basically focus on 3 pillars. First of all, mass customization, where we're targeting, for example, rare disease solution with specialized clinical nutrition products. These are Diet for Life, where we improve life expectancy for people going through our products. The second pillar here to highlight is the integration of products and services. So we launched at the beginning of this year the ModuLife platform for Crohn's disease patients, where we combine basically our product with a service in terms of food tracking, recommendation of ingredients. It's an exclusion diet where we provide that support to specialists and patients, and basically reducing inflammation for Crohn's disease patients. And these combination diets has been studied in clinical trials and published with a significant reduction of inflammation. We achieved a 75% remission rate and sustain over time. Let me just, for those who may not know, these are similar rates that patients achieve on biologics. So this is a significant impact for people's life going through exclusion diet and one of our product. It is patented, it has IP exclusivity, and it was developed with GI, gastrointestinal experts. Let me also highlight as a quick comment on the acquisition of Atrium Innovations in March of last year. We're very excited about the acquisition of Atrium Innovations. We're the two leading brands, Atrium, Garden of Life and Pure Encapsulation. Both brands represent 70% of the business of Atrium Innovations. We're confident about our ability to deliver on the acquisition plan. Now, innovation is great. Execution is key too. And let me just highlight how we think. It's a fail fast, move forward mindset. We're leading to success stories like the two highlighted here. We launched a woman vitamin brand, My Kind, first gummy to deliver a full organic, non-GMO certified product. We used apple pectin instead of gelatin from porcine or bovine source. Huge success a few months after our launch. The same applies to the doctor-formulated probiotics launch. We launched here a organic, non-GMO, the first shelf-stable solution probiotic, significant impact right after our launch. Now, impacting the well-being of people around the world is a key focus of ours, making a difference in every single day in people's life. Millions of consumers face challenges to reach their nutritional needs every day. And we're proud of being able to help with our products hundreds of patients, for example, in Crohn's disease. Girls like Sydney here on the picture. We met Sydney. She's on a Soul Nutrition on one of her products called Peptamen. And we met her parents. We've invited her over to visit our factory in Eau Claire in Wisconsin. It was an amazing experience for her to see how we source our product, how we manufacture with high quality. And it was an amazing experience also for our employees to meet and see the impact we're having on this girl's life and her parents. The same applies to cancer patients, where with our products, we reach more than 400,000 patients globally. We can make their life a little bit better every day by giving them access to nutritional support they deserve. Now, impacting individuals and society is core to our focus. We're focusing on three key pillars: ingredients and packaging, science support, and sourcing transparency. I just want to highlight here one thing we are executing as we speak. We are removing 100 million straws from our business in 2019. We will remove another 100 million next year in the US. And basically, by the end of 2020, we will have removed all the straws from our products. And this is not just pressing on a button and executing. We need to execute this hospital by hospital to make sure there is a smooth transition for their patients. So a few numbers on our business. We're focusing on delivering profitable growth in terms of continued acceleration. We have a sound business. We're comfortable delivering a 7% growth. We are in an investment position. We have potential for significant further improvements on the bottom line by driving growth, driving scale, and innovation. So let me just summarize. We have an exciting business. We have a successful model with very strong brands. We have the opportunity to scale and innovate for profitable growth. Thank you very much. Let's take questions.
Thanks, Greg. So we have 15 minutes for questions. getting tired, it seems.
It was very convincing.
Yeah, a very comprehensive presentation. No? Pierre, go ahead.
Pierre from Odo. You said at the beginning of your presentation that the consumer care market on which you operate is a bit fragmented. That's purely the case, because I think that the leader has less than 3% share worldwide. Do you think that there are the long-term characteristics for this market to be a bit more concentrated, or do you think that at best we can expect only regional big players to emerge, but global players, it's a bit tougher to expect? Thank you.
Yeah, it's a good question. I think that fragmentation is here to stay for a while. We won't see a significant shift overnight. I do think there will be consolidation. We've seen quite a few acquisitions around that category, and I think it will continue. Having said that, acquisition of a salad sauce of many brands across the world may not be the solution. So, careful assessment of that fragmentation and of clear opportunities is key to do the right thing in terms of consolidation. But I would say I'm expecting this fragmentation to stay for a long time.
Tristan, yeah.
Tristan Venstering from Redmond Partners. Maybe not a question for you, but perhaps from Joe, since you mentioned CBD. We've got companies like Canopy Growth looking at dog food with CBD. Is this something that Nestlé would consider?
All right, Joe, you got it.
Absolutely.
He said absolutely. Well, let me just say, out of the 19 SKUs we're launching in CBD, there is one pet formulation because it's just the same similar product in terms of the formulation, and it's the same channel. So right now that's a one SKU, but I think there is more opportunity for sure.
Yeah, Jimmy, go ahead.
Thanks. I think it was the 2011 seminar with Luis, he sort of presented the vision of this space between pharma and food, and that in 10 years' time you'd be market leaders. Can you give us a sort of appraisal of whether that was the right vision and whether that sort of focus has changed now? And then there were various investments, I remember, you mentioned VitaFlow today, but there were various other investments, very small, which I don't think have been successful. I may well be wrong. Can you give us an update on how some of those sort of, what I'd term more left field programs, how they have panned out? Thanks.
Right, thank you. So, I think the vision was very relevant then, continues to be relevant, and I've given you that feel of the vision on my first slide. It stays the same. How you go at it evolves, and you learn along the way. And I think some of the acquisitions, for example, that were made were part of that learning process. VitaFlow is a huge success story. That business has multiplied by 3 since their acquisition. They continue to be a significant innovator, and they drive significant profitability. The other acquisition have not been as successful. They've been great learnings. We've exited one, and we are currently reviewing the Prometheus business, which was one of the acquisition back in 2011.
Any other questions? Tom? Fine.
There was someone raising your hand in the back, right there.
No, it seems that okay, James.
Hi there. Yeah, just trying to think about how we should think about the split of the portfolio in the future between products which are bought at retail, products which are prescribed by healthcare professionals versus administered, on premise by healthcare professionals. At the moment, obviously, retail seems quite a small part, although bigger after the Atrium acquisition. In particular, how big does that part of the portfolio? How big is that like to grow?
Yeah. So good question. Thank you. So and maybe I can summarize your question is how big is the mass retail of Atrium? It's fairly small right now. It's about 5% of the total portfolio in terms of food, drug, and mass. That was one of the reasons for opportunities in the acquisition. And we expect this to grow significantly. The health food store channel represents about 15% of the category of consumer care. Food, drug, mass is 65%. Garden of Life has the potential to be a major player in food, drug, mass. It will take time. We're developing specific SKUs for that channel, and we're leveraging the big Nestlé and the capabilities that we have. So that's where we are. We're 1 year into the entry in the food, drug, mass in the US, and so far it's going very well. I can tell you that on a 4 weeks basis, we are the #1 absolute growth driver in that category in food, drug, mass.